Hello, everybody, and very warm welcome to our International Medical Graduates IMG ST1 induction event. Hopefully everybody will be muted as they come in, and you're welcome to turn on your cameras if you wish to. And please feel free as you come in and settle down into the program to tell us in the chat, hello, who you are and where you're coming in from, where you're watching from. My name is Sylvia Kama-Kieghe. I'm a GP based in Sheffield, and it's my pleasure to be the chair for the event today. I believe we have quite large numbers registered for this event, which is really exciting, and it's lovely to see you all here for what promises to be an instructive and productive day. So firstly, let me start by congratulating you all for getting accepted into GP training in the UK, and be one of those to officially welcome you to your profession and your professional home, the Royal College of General Practitioners. Now, before we get into the program, let me tell you a little bit about myself. I'm also an international medical graduate, originally from Eastern Nigeria, and I received my primary medical qualification from the University of Lagos in Nigeria. I'm not going to tell you how long ago that was, so you guys can keep guessing. We never reveal our ages. But yes, just like yourselves, I came into the UK some time ago to start my training. I've worked as a salaried doctor and a locum GP for about 15 plus years now, and became a fellow of the college in 2021. These are terms that you're going to be familiar with as the day and as days go on. Currently, I'm working as a clinical supervisor at the Sheffield GP Out of Hours Collaborative. Now, some of you may know, or you will come to learn very soon, the college is grouped geographically into various faculties across the United Kingdom. And I also work or serve as the chair of one of those faculties in the northern part of England, called the South Yorkshire and North Trent faculty. So that's a little bit about me, and I look forward to meeting some of you in some way or the other, in some event or the other in the very near future. Training and working as an IMG GP in both the NHS and private sectors has been really a fulfilling and challenging experience for me to date. And if I had to choose again, if I had to sort of start training all over again, I would recommend and I would choose general practice as a specialty to be in every single time. So before we dive into the rest of the program, let me share a few points on housekeeping for everyone to observe so that we can all have a smooth experience during the session. And then I will share the agenda for the day. So as much as possible, please leave your volume on mute to reduce background noise, and your cameras on if possible. It'd be lovely to see you, and that makes for better interaction, but it's not mandatory. You know, please be comfortable, be as comfortable as you want to be. We know there'll be lots of questions and welcome them. We will be, for the sessions later on in the morning, be sticking to the Q&A function. Right now, where the chat is open for you to say hello and tell us where you're watching from, or where you're coming from, your original country. But for sessions later on in the morning and in the afternoon, we're going to be using the Q&A function to make sure that we don't miss anybody's question. Or at some point at the end of a presentation, when the presenters finish, there can be an opportunity to raise your hand if you want to ask your question directly. Please remember to change your name as you appear on Zoom to your full name, to make sure that we're identifying you and making sure that you've attended. And can we ask, please, that you complete the feedback form that will come up at the end of the program. It will usually be shared in the chat at the end of the meeting. And so just to inform you that the sessions are being recorded, so please don't worry if there's something particular that you're interested in and you want to capture. Don't worry, we will share with you for a limited period of time the recording of the program. So your questions are welcome. Like I said, please feel free to answer. We and all the speakers will endeavor to answer all of them, but there are quite a number of attendees, so we may not be able to cover everyone. Please just bear that in mind. So on behalf of myself, the team working with me, you're very much welcome. In terms of agenda, here's a quick look at what to expect. So very shortly, within a couple of minutes, we're going to start with a brief conversations with two leaders from our Royal College community who will be sharing their professional experience with us and give you a hint of what to expect as you undergo training and begin to practice in the UK. Then next, we'll have a little look in a bit more detail into what life and work in the UK is all about, and perhaps, provide you some helpful tips to become more familiar, especially for those who may be arriving in the country for the very first time. Some of you may be here already. Some of you may still be abroad and about to set off or travel down. This will be followed by a conversation or a presentation with one of the leaders, with a leader for one of the UK medical indemnity defense organizations. And after that, we will have an hour's break for lunch. So that will be at 1 p.m. lunchtime. We'll come back at 2 p.m., so 1 hour for lunch, and then we'll dive into an aspect that I know many of you, if not all of you, will be very much interested in, and that is understanding the training program, learning about your workplace-based assessments, examinations, your portfolio. And that will leave us to round things up with the last but not the least presentation from our professional regulator, the GMC, looking at ethics and fitness to practice in the UK, and hoping to close our session at 4 p.m. today. So that's the agenda. I've not been looking at the chat, but I hope that people are sort of sharing where they're coming in from today. And it's, like I said, it's really great to have you on board. Now, I mentioned a little bit about the structure of the college earlier and how it's split into faculties where you'll soon be members. The Royal College is led by a council of elected representatives from its membership and non-member executives. This council is led by the RCGP president, the chair in England, in Scotland, Wales, and Northern Ireland. And we have other officers, for example, vice chairs for strategic areas, including finance, professional development, and external affairs. So at this point, I'm very pleased, and it's an honor for me to welcome Dr. Victoria Tzortziou Brown, OBE, who is the current Vice Chair for External Affairs of the RCGP. As the college's Vice Chair for External Affairs, Victoria has core responsibilities on health policy, systems working, and integration. She's been an East London GP for over 20 years and has worked across health and social care, academia, and within communities. She's very much interested in identifying innovative solutions for improving health and care services and narrowing health inequalities. And she has a particular focus on the design and evaluation of healthcare interventions and the impact on professional behavior and health inequalities. Victoria, I'm so pleased you could join us today, and thank you for coming. Are you muted?
Sorry, apologies. Can you hear me now?
Yes, you can.
Thank you so much. Thank you so much for having me. Thank you.
That's great. Well, from your bio, your brief bio, you clearly have your hands full with what sounds like a very interesting career. Would you mind starting us off? Please tell us a little bit about yourself and your journey, your medical career journey, please.
Okay, so I will try to summarize over 20 years in 5 minutes. So let's see how I will do.
Okay.
So I was born and grew up in Greece. And for some reason, I wanted to be a doctor from a very, very young age, despite the fact that nobody in my family were actually doctors. So I worked really hard at school, like I'm sure all of you did, and I managed to get into medical school. And during medical school, there was an exchange program, an opportunity to come to the UK just for 6 months. So I took this opportunity and I came to the UK during the clinical years. And the 6 months became over 20 years. So I stayed. I did my house jobs here. Then I entered obs and gynae as a specialty because this is what I wanted to do at the time. And I progressed. I became an obs and gynae registrar. And at some point, I had to decide what subspecialty I wanted to follow. And although I loved surgery, I loved many other things as well. So I found it really, really hard to decide what subspecialty was for me. And this made me really take a step back and reflect on myself, my personality, the fact that I like to do too many, lots of things. And I almost felt claustrophobic having to decide one small specialist area. So at the same time, quite a few of my friends were training in general practice, and they seemed to love it. They seemed so happy, and they talked to me about general practice. I started to understand it better, and I decided to change careers. So I had to go back to training. I managed to get a specialty number, back to training, back to A&E. And I never regretted it because it opened so many other possibilities for me. So the day I graduated, when I got my RCGP, I decided to join my local faculty in Northwest London, and I was invited to the ceremony. I met local colleagues, and essentially I became the educational lead of the faculty. So at the same time, and after working a little bit as a clinician in general practice, I started thinking that I would like to subspecialize a little bit more in musculoskeletal medicine and sports medicine. So I started an MSc in sports and exercise medicine. And this MSc kind of made me very interested in undertaking further research. So shortly after it, I enrolled in a PhD. And in a very kind of true generalist fashion, I couldn't decide to focus my PhD on a tiny, small area. So I combined medical education, professional behavioral change, and evaluation of complex interventions and referral management in one PhD. But I loved every minute of it, despite the fact that it was very, very hard academically. And despite the fact that I had a very young family, my children were babies at the time. In the meantime, as I was finishing my PhD, I was working in East London. I've worked in East London for all my clinical life. And I really enjoyed this area because of its diversity. So we have, our patients speak over 90 languages. We have the fastest growing population in England. We have the largest Bangladeshi and Chinese communities. We have probably the largest proportion of Muslim residents in the country. So it's so diverse. And I felt that I wanted to do more to improve the healthcare locally because there was so much need. And I felt that through research and through one-to-one clinical practice, yes, I had an impact, but research was too slow and I wanted to make a difference at a bigger scale. So I started getting involved in clinical commissioning. So clinical commissioning is essentially making decisions on how to spend the local funding for local services. And I became a clinical commissioner before the time of clinical commissioning groups. So we had primary care trusts at the time. And then I joined the local clinical commissioning group as well, that's CCG, and I became the lead in initially plant care, then integrated care. And I worked a lot with secondary care colleagues, social care colleagues, patients to redevelop pathways to redesign services. So it was all really, really interesting. I continued research and I focused more of my research on health policy more and more. And all these years, I continued getting involved with my RCGP faculty too. And I did almost every role in the faculty. So after educational lead, I became the treasurer, then I became the vice chair, then I became the chair of the faculty, and then I became chair of the London faculties. And at that point, colleagues of mine that we developed very supportive relationships, very good friendships, they started pushing me to be more involved with Central College. And I remember I was a bit scared about it, probably. I was a bit ambivalent about it. But anyway, I applied to become an officer, and I applied for the role of honorary secretary, which is essentially the honorary secretary has responsibility for governance within the college. So it's a quite demanding role. And to my surprise, I was elected. So as a non-honorary secretary, I had the opportunity to actually run some of the largest consultations, member consultations within the college. So we had consultations on sponsorship and assisted dying, which now is being repeated. And we developed ethical guidance for primary care during the pandemic, which was a very, very difficult time. So I developed guidance, for example, on the remote verification of death with a BMA. And it was a very, I remember that time as a very intense time, a time of, where I felt great responsibility to get it right, amongst a lot of uncertainty, clinical uncertainty and ethical uncertainty as well. And if you remember, if some of you were around, lots of us at the time, lots of us GPs were volunteering to help hospitals as well, not just doing the work in general practice. So I remember I was volunteering with colleagues at the local hospital to try to empty beds because people needed to be transferred from ICU. It was just a really, really difficult time for everyone. And then after the ONSEC, I was re-elected in my current role, which is the Vice Chair for External Affairs. And I work now closely with Camilla on health policy. So we took some, I think, brave decisions probably in policy. So for example, we ran the consultation on physician associates, and we designed the scope of practice for physicians associates in general practice. We also did quite a lot of work on CQC and how CQC can become a more trustworthy for GPs, and how can we reform it to, and now we are working with CQC colleagues and members to try to make things better for practices. So it has been a real roller coaster. What I have mentioned are just the successes. There have been, believe me, lots of failures amongst those years.
I was going to pick up on that. I was just going to pick up on that, but I think it's amazing the way that you have sort of steered us right from some of the challenges that our audience would experience, you know, sort of moving from one specialty to the next. You've steered us through that, talked about working in diverse populations, helping to set up policy in your local communities, and then to leadership. And you're still practicing at the moment. So what a snapshot of such an interesting career. But yes, as you said, I'm sure there would have been one or two challenges. Can you share any with us that and how you overcame them? Because I think for people in the audience starting off now, it will be good to hear them and know that it's possible to get over them.
Yeah. So one of the challenges which you touched upon is the change in careers. So here I was an experienced registrar teaching other people on how to do surgery, and I had to swap to general practice, and I became a trainee, which can affect your confidence. So my first job was at the local A&E at the Royal London Hospital, which is very, very busy, lots of trauma and complexity. And I really felt out of my depth. I had to ask for advice all the time. So how I overcame this, I guess, is through very supportive colleagues. So your team really, really matters, I think. And the other thing that kept me going was this vision that I really wanted to become a GP, and I could see the reason for which I was doing, or I was making all this effort, and I was taking up this challenge. And I guess the second challenge that I had from a policy perspective was, as I mentioned before, during the pandemic, you know, having to develop ethical guidance for primary care. And I remember there were so many there was so much new knowledge at the time. So, for example, we were under pressure to argue for the prioritization of ethnic minority groups for vaccinations. But having worked in East London and knowing, you know, my population, which has lots of ethnic minorities, I knew that just by prioritizing those people didn't mean that they will take up the vaccinations. So I wanted us to focus on how do we engage with these communities so that they can be vaccinated. But I was not certain how to make this point to policymakers, because I could say, you know, this is my experience, my personal experience, but that was not enough. Sorry. So what I did at the time was I rallied up all the academic clinical fellows, so the trainees, academic trainees in London and beyond, and we decided to just do a very quick evidence review and write up all the evidence about what makes diverse communities take up interventions, especially around prevention. And we created very rapidly. We developed this evidence. We put it up on the website, and then after that, there were lots of initiatives in lots of areas in the country. So, for example, vaccination buses and the outreach work that we did, and us going to the communities rather than expecting the communities to come to us, which was just a joy actually to see. And it was really kind of fulfilling.
Yeah, oh gosh, I mean, those are really challenging times. Well, thank you so much for sharing those. We've just got literally 1 minute, and I know I have to let you go. To this group of trainees, of our new registrars, what are 1 or 2 top tips that you would share? I've just got literally 1 minute, just 1 or 2 top tips that you would share for people today.
Yes. So one thing that I would say is enjoy the journey and don't rush it. So enjoy every minute, enjoy even the times when the things are tough, because actually difficult times and challenges and failures make us better people, make us more compassionate, make us more understanding and tolerant. So as I said before, I did every single job in my faculty, in my university, in my practice, in the city. So don't feel that you need to rush to go to the top positions, because actually all this experience of the front line is very, very helpful. Otherwise, we, especially from a policy perspective, we develop policy that is not implemented or maybe even be harmful. So this understanding of implementation of how things work on the ground is really, really helpful, and it will serve you well throughout your careers. So enjoy every minute. General practice is an amazing career. We'll offer you lots of opportunities. Take those up.
Amazing. Thank you so much for sharing those insights, Victoria. It's been amazing speaking with you. I know you've got to rush back to clinic, so thank you for making the time out of your busy schedule to be with us. And I know that we will catch up with you at some point, sometime soon. Thank you so much again.
Brilliant.
So everyone,
thank you. Good luck.
Thank you. Bye-bye. So everyone, we've been hearing from the Vice Chair for External Affairs of the RCGP, and as she's told us, a very busy practicing GP in London, hearing about her experience and career journey. Now, next, we have the opportunity to hear from someone who is also a national leader in the RCGP, and a little bit closer to you on that career journey. You are new registrars, and they've been doing amazing work, both as a trainee and a leader representing you. So our second guest is Dr. Deepthi Lavu, who is a co-chair of the Royal College GP Registrar Community Group. She's an academic GP trainee. She's based in Exeter, having moved to Devon, southwest England, with her family in August of 2021 to begin training. She's currently at the tail end of her training and about to step into the real world of general practice as an independent practitioner. So Deepthi, it's a privilege to have you to speak to us today. Welcome.
Thank you. Thank you for having me. And hi, everyone.
Thank you. I mean, if you're having a look at the chat, there is such a bubbling community of people getting to know themselves, and I'm sure they'll be really eager, just as they've listened to Victoria, really eager to hear your own experience. So can you start us off, please, by telling us about yourself, a little bit more about yourself and your journey so far in your medical career, and especially as it relates to being a GP registrar, because I'm sure that Victoria has her registrar days several years past. But you're in it, you're in the thick of things, and I'm sure you can say things that will resonate with us.
No, thank you so much. And I should say my journey has also been fairly long. The reason why I say it is I, very similar to Victoria, did obs and gynae in the past and decided that I didn't want to do night shifts anymore and switched to GPs. So we had very similar journeys. I came from India. I lived in South India, did my medical, I'm a medical graduate from there, got married and moved to the UK. So I came more for family reasons. My husband he grew up in the UK, so we didn't have too much of a this, you know, should I say, we didn't have, we had only two options as to where we were going after we got married. So yes, it wasn't the job or the country otherwise, it was a person who drove me here. Came down, I did obs and gynae for many years, very much like Victoria. I was a senior registrar in obs and gynae, about a year and a bit away from getting my CCT there. So it was the consultant job was something I could almost hold and touch and feel and smell. And at that point, I just thought, I can't do this for the rest of my life. Night shifts is not what I want to do. And with my husband being in an acute medical post as well, I couldn't just see how it would work for everyone. So at that point, I decided I'd switch to GP. I was always really, really interested in research. So I did research quite a bit when I was doing obs and gynae. I did a master's in Kiel, at Kiel University in obs and gynae. And I took up an academic GP registrar job in Devon when I decided to switch specialties. So I stuck with research and I'm still doing research. I am an ST4 now. Just about a few days ago, I had my final ARCP for the registrar bits. And I finally signed off. So it's almost there. I'm almost a fully cooked GP.
Amazing. Well, let me be the first to one of the first to congratulate you. That's amazing. Thank you so much for sharing that with us. And it's incredible, the journey. And I'm so glad you touched on things that are really relevant to us in terms of work-life balance and family and, you know, the decisions that we have to make. And just like Victoria, you've managed to condense, I'm sure, a very, very busy, really interesting time career-wise and professionally into just a few minutes. And I'm sure there would have been times that you really hit your head and wondered, what am I doing? Challenging times. Could you share with us, you know, some of them that sort of stick out in your head? I know that we have unique and similar experiences, but maybe one or two challenges specifically that you've been through in your work as a registrar and how you overcame them.
No, thank you. When you say challenges, I remember zillions of them. And at various points, I'm going to try and pick some which might be most relevant to my colleagues here. I guess the first thing when we talk about challenges is my first job in the UK, which comes to mind. So in India, I grew up in a family of doctors. So my grandfather was a doctor. All his children were doctors. They married doctors and they bred doctors. So essentially, this was bread and butter for us. I was just one among the hundreds of doctors in the family. I was a really good student in medicine. So I came out with first class honors and distinctions in a number of subjects. So I was really bright there. Came to the UK, passed my exams first shot, no problem at all. And I start my first job as a surgical SHO. So I did my F1 in India and I started off as an F2 job here as an SHO. The day shifts were fine because there were so many colleagues who were helping you out. Everything was okay. If you didn't know, you ask and they help you. My first set of nights, I was in bits. I think I just managed to hold everything through because it was absolutely terrible. I didn't know what I was doing. I didn't know who I could ask for help. There was just one other registrar who I could possibly ask, if anything, and the registrar was really annoyed that I was this very poor IMG from God knows where, who had no clue about what they're doing and is definitely going to kill some patients. And I felt I was going to kill some patients. Failed to do bloods. I was really good at doing bloods. I failed to do bloods using this new technique, using different needles. I tried in 3 places. I didn't get it. And usual thing, PLAB exams. Oh yes, if you fail, I'll call the registrar. I called the registrar. She gave me a look and said, what will you do if I wasn't there?
Oh dear.
An arterial stab? Then go ahead and do it. I not getting arterial stab in the wrist, then go in the groin. So I actually drew bloods from the groin because someone wasn't ready and they saw me as a really poor doctor. That was night 1, and that repeated night after night after night. I'd finish my night shift, go back to my room and cry. And I cried and cried and cried. I remembered I had to sleep, so I slept for a couple of hours, go back again, repeat for the whole week. And I think there was just one thing that stuck in my brain, which was, Deepthi, you're not bad. You've worked really hard and you were always an excellent person. You just need to understand the system, and it's not hard. And the one thing that kept me going is every time I hit some roadblock, I'd go, when things get tough, the tough get going. Deepthi, you're good enough. Just keep going. And it was fine. The next night shift, one of the registrars went back and said, I don't know why you complained about her. She wasn't that bad at all. And then by the fourth set of nights, I was doing everything by myself. So it's just that learning curve. So give yourself grace. And when very similar to Victoria, so that was my first job as an SHO, but as a GP registrar, you're slightly higher, you're a bit more qualified. And it's interesting, when you've done obs and gynae for 7-8 years, very close to CCT, you forget that there are men, you forget that there are children, you forget that there's other body bits other than reproductive organs. And when I restarted, I was worse off than when I just finished medical school. Into my first job as a GP registrar, sadly, my first job was also in general practice, where your presentations can be so random, they can be unexpected. You don't know what's coming through the door. It can be any problem, and they'll throw 2 or 3 things at you. When you haven't done any other medicine for a really long time, and you haven't done a hospital job either to break you into the system, and you're thrown in GP, my GP trainer looked at me and said, Deepthi, you're really, really qualified. And I'm sure you're really good, but that was worse than a medical student. And she got a medical student in and showed me how they do the job.
Oh dear.
It was heartbreaking because I knew I was really good. And again, it was a push from there, kicking myself, going, Deepthi, you know you're good, and I know you can do better. I think what really helped me was me studying for my AKT exam, because then I was revising everything, seeing patients. But also it's that persistence with me saying, actually, I can do better. And I know I can do better. Just don't worry about what everyone else is saying. You're good enough. And learn from your mistakes. Be open and say, yeah, actually, what I did there was, sorry, I was going to say shit, but I'm not going to say it. And just get over it. Accept you can make mistakes and you'll be absolutely fine. And by the end of that point, so right now when I have a lovely relationship with my trainer. So there was a point where she said, I tried to get 6 months waived off because I did obs and gynae in the past. And she said, no, it's a bad idea for you because you have experience, but you're not experienced enough in GP. I said, but this is a known pathway and I have enough competence to be able to be waived off 6 months. So at my ARCP, although we had a really good relationship, she marked me down saying I wasn't fit enough to have 6 months waived off.
Oh.
And this was with her not telling me she was going to do it. So it came as a sort of a backstab when I looked at my portfolio. I challenged it. And very interestingly, the ARCP panel said, actually, Deepthi, you are right. Your trainer did not know what they were asked to do or justify, and they waived my 6 months off. It was hard going back to the same GP practice because you're in the same practice for 2 years and seeing her face and she's my trainer again.
Oh dear.
Actually, this year, I've kept a good relationship with her, gone back. I never gloated on it. It was a very matter of fact thing. And she says, I'm one of her best trainees she's ever had.
Oh, wow.
So it's changed from one extreme to the other.
That's amazing. I think you've touched on so many interesting points in those challenges, because whether people are coming to the UK for the very first time and faced with a totally new way of doing things, or whether they've been doing some other specialty like you for a number of years and it's all been pediatrics or it's all been O&G for many years, and now you're expected to go into general practice when you haven't touched the child, you haven't examined any other system but a woman's gynecological bits. How do you cope? And I'm so pleased that you shared those experiences and how you pushed yourself forward and that self-confidence. That's really amazing. I've just got 1 minute before I need to let you go. And I think it would be amazing if you could give 1 or 2 tips to our audience here, because you are one of their representatives. You're actually speaking on their behalf. And from your experience, what are 1 or 2 things you say to the ST1 at this stage of their training to help to support them?
So I'd say first thing is just give yourself space. It's okay to make mistakes. If you do, put your hands up and say, I'm sorry, learn from them, try not to repeat them, and just move on. Second thing, just believe in yourselves. it takes resilience and courage to move countries. It takes resilience to relocate your families, leave your families, you know, fit into new systems. So that shows how much strength you have. You probably know 2 or 3 languages. Lots of people who speak English probably just know 1 language. So don't compare yourself with them going, actually, I'm not great at English. You have to remember your strengths. And just remember that you're going to build networks, not in 1 country, but 2 countries. You probably know way more people than anyone ever living here. So just give yourselves and believe in yourselves. And I'll say, keep your friends and families close. I remember when I was kicking myself at one point, saying my child is unwell, but I dragged myself into work and I was half split on it. This nurse came up to me and said, Deepthi, you know what? If you don't turn up to work today or you call in sick, they will immediately find a replacement for you. But the child you've left unwell in nursery, struggling by themselves, has no one but you to take care of them. So don't ever forget that you're the only one person for your family, which you can't be replaced. So just, I think, remember it. I think as registrars, it's an absolute journey. It will be amazing. You are going to have challenges. I had challenges, but right now, where am I? I'm representing all of you guys as a co-chair on the RCGP Council, representing 19,000 of you guys on a council which is the professional home of our college, where you're trying to be the voice, and it will happen when you open yourself up to opportunities. So don't be scared. Put your hand up and say, please, can I try? Or what is that? And get involved, because you will have so many opportunities. Just enjoy yourself, really, really like it. Remember their challenges, but there is always another end. And it's only a small part of your life.
Amazing. So well spoken. What an amazing pair of guests we've had today. Thank you so much, Deepthi. I really, really appreciate your time and the comments, the encouragement. My deep appreciation to you. So you guys, you've been speaking to Dr. Deepthi Lavu, who is co-chair of the Royal College GP Registrar Community Group, and we've spoken to Dr. Victoria Tzortziou Brown earlier, and my deep thanks to them for sharing insights from their experience. Thank you so much, Deepthi. I know you have to get on with other things, and hopefully see you at some point again soon.